live.
You mean Lucky couldn't afford any more than that?
I suppose they could, but they were judicious to borrow a word from Michael Jackson.
Oh, I'll never work for Lucky's now, that's for sure.
By the way, I want you to know right away that the Institute for Female Alternative Medicine at Temple Community Hospital has a phone number that is 800-505-IFAM, 505-IFAM. And it is Dr. Tirso del Junco, Jr., who was with us the other day for a few minutes, and far too few, so we've invited him back to talk about unnecessary surgeries, among them evidently, which I think you said I had one. You believe? A hysterectomy for endometriosis in 1971, I guess it was.
When you were 12.
In my 20s.
It is a little early.
12.
But I had thought that my problem, blocked fallopian tubes, and very blocked evidently, was so severe that even today you would have said, no, in your case, Stephanie, you probably should have had the complete hysterectomy. You say perhaps not.
Perhaps. There are certain situations, obviously, that when you have certain types of disease processes, the hysterectomy is the treatment of choice. As we mentioned last week, though, there's 650,000 on the average hysterectomies being done a year.
You hear this? Yes. 650,000.
That are not necessary?
Well, no,
or
total.
that are done?
And in America alone or around the world?
In America. Good. And of that 650,000, maybe 15, 18%, at the most, 20% is done for cancer. So there's a significant number of hysterectomies that are being done for non-cancerous, non-malignant disease, one of which is endometriosis. I think probably the most important thing that the message that needs to get across is not just what the procedure that I'm advocating and that I do is a female alternative procedure that treats multiple diseases, one of which is endometriosis, others of which is fibroid tumors being the most common of the disease processes that requires a hysterectomy.
What is this procedure? What do you do?
They've been doing, in this country, they've been doing myomectomies or removal of fibroid tumors for 30, 40 years. It's not a new procedure from that standpoint. The technique that I use is different, and it allows us to remove these tumors without losing a lot of blood. I think we have a couple of pictures of one of which we can show that will demonstrate.
Tumors up here. Mm-hmm.
That first, if we can go, there was one picture prior to that that shows the normal anatomy, and in that one right there, as you can see, the uterus is predominantly a muscle, and it's very, very rich in blood supply. And traditional surgeons have a difficult time removing tumors that are very deep because of the problems of losing blood. In the next picture, you'll see that the fibroid tumors don't respect a certain part of the uterus. They can be anywhere in the uterus. And the bottom picture, the tumor that's sitting on top of the uterus is the kind of case that we see in this country that's most often treated with a myomectomy. Having a technique.
It's laser you're talking about.
The technique that I use, we use multiple different lasers in doing the procedure. And the technique that we use is a combination of techniques to allow us to remove those tumors that are very deep in the muscle without losing any blood. I've taken out as many as 65 tumors from a woman's uterus and reconstructed it, and she's today still having normal periods.
Wow. Let me ask you something. What do you think, why do you think there are so many operations that are unnecessary? Is it money?
No, in
or is it misdiagnosis?
1998, there's very different reasons than what it was back when you had your surgery. The old school of thought, in most cases, women, you've had your children, you're close to menopause or reaching menopause, you don't need your uterus anymore, so just take it out.
Let's get rid of that troublesome part of your anatomy.
Right.
That was often the case.
So it's pretty male-dominated then, in a sense. I mean, does that have
It's male-dominated, but I got to tell you that there's a significant number of female gynecologists who are trained with the old philosophy that still advocate the same treatment.
Well, what does that do to one's body hormonally? I mean, whether you're taking hormones or not, I'm very lucky. I have not had to have a hysterectomy, and I'm getting close to 42.
My age.
Yes. And no, I'm past menopause.
You've had children?
Oh, gosh, you know, 17, 18. So I don't need children anymore. But I find that it's a wonderful time in my life.
Right.
And I wonder what would have happened if I had had... What would have happened hormonally?
Let me tell you what happens. Your sexual urge diminishes almost immediately, and it's very hard to pull it back up again, even though you're on hormones.
That doesn't have to do with the massive doses of Thorazone that you're on.
No, nor does it have to do with a wonderful husband. Great marriage.
Right.
Wow. But you realize that something is missing chemically.
Even with hormones that you...
I think so.
Oh, yeah. There's, you know, there's a lot of studies that support the fact that increase in heart disease, osteoporosis
Right.
are known reasons as to why you should keep your uterus. But what you've just mentioned is a subject that
Is a
back
big
when
one.
you had your hysterectomy is very taboo. Not many people would talk about
Yeah.
sexual dysfunctions.
That's
But it's
right.
a huge issue, big issue.
We have a question for the doctor coming in from one of you, dear folks, so we will take that. Whoops. Well, we were going to take it.
I am
Neil,
such
our
a klutz.
stage manager, no, he just isn't good enough at the work.
Oh.
All right. Carol is interested in donating an egg. Would that affect her ability to bear a child? Carol in Sherman Oaks is asking this.
No. One of the big reasons, obviously the #1 reason why one should try to preserve the uterus is for fertility, obviously. Allowing us to remove the tumors that line the uterus or the endometrial cavity, if that is done properly, and there are women who have had successful pregnancies even with fibroid tumors, but the incidence is low. The incidence of losing a child during pregnancy is high. Our procedure allows women to retain their fertility, and at the same time, whatever choice they want to make, whenever they want to make it later, they're successful.
And retain a lot of other things, the moisture of the skin.
Yeah.
I took a test last year about loss of bone density, I guess it
Right.
is. Mine is greater than it should be at my age. I have broken bones, both wrists, in recent years that probably may not have happened without that early surgery. And so, but we have just recently come to that philosophy where if it was in there, you don't consider it, quote, a troublesome part of the anatomy unless there is an area that is troubled, and then you deal with that area.
Exactly.
With the laser, do you always make incision, however, to use laser?
We make a skin incision in a traditional way. How we treat the uterus, how we treat the ovaries, we use multiple different laser techniques with different types of lasers. So we try to preserve as much normal, healthy uterine tissue, ovarian tissue as possible, and we're able to do that with the use of the laser.
Is the medical community beginning to come alongside you, or do you feel there's resistance?
There's still a lot of resistance. I think that there's 2 procedures that are being talked about, one being here done at UCLA, and another one called the opera procedure, which are minimally invasive type procedures, and that's good, that's positive. In my opinion, we're striving to get people to understand that hysterectomies shouldn't be done. So as long as there's a move towards alternatives, and we're giving women alternatives, that's my concern. And right now, it's positive. I don't think it's the way to go yet, because it's too early in some of these studies to know what the outcomes are. Fertility is removed in one of the procedures for sure. So if you're wanting to have children, one of those procedures doesn't say right.
But isn't it good to have a doctor talking to you about this? Dr. Tirso del Junco, Jr. is the gentleman. And again, I say that it is his institute, that of your father's and yours, is it?
No, it's mine.
It is yours.
My father being a physician as well, but this is...
This is yours. For more information on the Institute for Female Alternative Medicine at Temple Community Hospital, call 1-800-505-IFAM. We are pleased to let people know about you.
Well, thank you for having me back.
You bet.
Appreciate it.
Do you know who's coming along to sing for? Well,
Melissa Manchester. Oh, I love her voice so
She is
much,
here.
I can't tell you.
She has waited, and her wait is over. We'll come back
And she'll
with
see me
Melissa.
without my Velcro rollers on.
That's right.
Nice. And
in
you too.
just a moment.